going to be your nurse today. Is it okay if I do a physical assessment on you?
Sure.
Okay, great. So I'm going to start with the skin assessment. You have a medium beige tone. You have a lesion on your lower leg, about 2 millimeters. I'm just going to touch your head if that's okay. Check your temperature. Okay, you're warm and moist. And I'm just going to pinch your chest if that's okay. Okay, thanks. Okay, and no trigger. Okay, I'm going to have you sit up. Okay, I'm just going to ask you a couple questions. What's your name?
Lauren.
Where are you, Lauren?
Sweet Dempsey.
And what day is it?
On Friday.
Okay, great. Okay. Okay, I'm just going to have you open your mouth for me. That's okay? Okay, open wide. Say ah. Okay, great. Okay, uvula is midline and tongue is midline. And we're going to test your gag reflexes. So I'm going to stick this in. Okay, good. Gag reflex is intact. Okay, I'm going to check your eyes for perla. Okay, so your pupil right now is about 4 millimeters. So I'm going to check for direct constriction. It constricted to about 2 millimeters. Now I'm going to check for consensual constriction. Okay, great. Constriction in both eyes. Okay, so your pupil on your left side, on your right side, is also about 4 millimeters. Constricted to about 2 millimeters. Now I'm going to check your consensual constriction. Okay, great. They're both. Okay. Okay, so next thing we're going to do is I'm going to check your 6 cardinal fields. So I'm just going to want you to follow my finger, okay? Okay. Okay. Okay, great. Okay, now I'm going to check your visual fields. So just tell me when you see my fingers, okay?
Okay. Okay.
Okay. You want me again?
Okay. Okay.
Okay, one more time.
Okay.
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 Okay, great. Okay, now I'm going to test your visual acuity. So you're going to hold this about 14 inches from your face. And if you could just read that bolded line for me.
Okay. Medication administration record.
Okay, great, thanks. Okay, I'm going to have you stand, Lauren. And I'm going to have you stand about 20 feet away from that chart. And if you could cover your left eye and read the chart with your right eye for me.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC LEFODPCT, and I can't see that.
Okay, so you are 2013 in your right eye. If you could switch eyes for me and read the chart with your left eye.
Okay. EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC LEFODPCT PDPLTCEO.
Can't see the last line? Okay, so you are 2013 in your left eye as well. And if you could read it with both your eyes, please.
EFPTOZLPED PECFD EDFCZP FELOPZD DEFPOTEC LEFODPCT FDPLTCEO, and I can see that.
Okay, so you're 2013 in both eyes as well. Okay, so you could have a seat. Okay, I'm going to check your face for facial symmetry. You could look at me if you could smile, frown, puff your cheeks, close your eyes, open your eyes, raise your eyebrows. Okay, symmetrical, great. Okay, so now if I could have your hand, I'm going to want you to identify what is sharp and what's dull. So I'll have you close your eyes. This is the sharp side and this is the dull side. Okay, so you're going to close your eyes.
Sharp, sharp, dull, sharp, dull,
Okay, next hand.
sharp, 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 dull, dull,
Okay, I'm going to do the same to your feet, okay? Ready, and
sharp, 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 dull, sharp.
okay. Okay, so the next thing I'm gonna do is I'm gonna test your hearing. I'm gonna have you close one of your ears, and I'm gonna whisper in the other ear. Okay, and you just tell me what you hear. Okay, come from behind.
One more.
Okay, and switch ears.
Banana.
Okay, great. Okay, now I'm gonna talk in a normal volume, so you just tell me what you hear, okay? Tomato.
Tomato.
Okay, switch ears. Apple.
Apple.
Okay, great. Okay. Okay, so I'm gonna, if you could just lower your hospital gown, I'm gonna listen to your respiratory sounds. Okay, yeah, so I'm just gonna clean my stethoscope. Okay, I'm gonna listen to your breath sounds for a few minutes. Okay, so you're breathing at a rate of 16 breaths per minute. You have regular pattern, and no labored breathing and no use of accessory muscles. Okay, so while I'm here, I'm just gonna listen to your lung sounds from your front. So, yeah, okay, great, thank you. Okay. So if you could just take a deep breath every time I move my stethoscope. Okay, deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Can I just lift this over here? Is that okay?
Yeah.
Okay, great. Deep breath. Great. Again, I'm just gonna lift it on the other side if that's okay. And deep breath. I'm gonna listen axillary. If you just lift her. Great. Deep breath. Great. And deep breath. Okay, thanks. Okay, so I'm gonna come around and listen to your lung sounds from the back. Okay, and if you could just take a deep breath every time I move my stethoscope again. Okay, and deep breath. Deep breath. Deep breath. Deep breath. Deep breath again. One more time. Deep breath. Deep breath. Breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay, lungs are clear and bilateral, no adventitious breathing. Okay, Lauren, I'm just gonna put my arms around the bottom of your lungs, and if you could just take a deep breath when you feel my hands there, I'll tell you about it. Okay, sorry if my hands are cold. Deep breath. Okay, good. Okay, so chest expanded symmetrically and bilaterally. Okay, so if you could keep your nightgown down, I'm just gonna listen to your cardiac sounds. First, I'm gonna take your pulse rate and match it with your apical pulse for a full minute. Okay. breathing at a rate of 76 breaths per minute. Your pattern is regular and your rhythm is regular. The rate is regular. No heart murmurs. I didn't hear any heart murmurs or any. Okay. Now I'm gonna listen to your heart sounds, starting with the aortic. Second intercostal. Okay, pulmonic. Nerves playing. Tricuspid. And mitral. Okay, thanks. Okay, I'm gonna have you lay down, Laura. Okay, and if you don't mind, I'm just gonna feel for your pulses. Okay, first I'm gonna feel for your radial pulses, your radial pulse. Okay, great, and I'm gonna feel for your brachial pulse. Okay, your carotid. Okay, great. Femoral, can I just lift that? Okay. Popliteal, just gonna lift your knee a little bit. Okay. Posterior tibial. And dorsalis pedis. Okay, now I'm gonna check for capillary refill on the bottom since I'm here. Since you have nail polish on, I'm just gonna check for it at the tip of your toe. Okay, and there is about refill of 2 seconds. Now I'm gonna check for pedal edema. Okay, no pedal edema in your lower extremities. Oh wait, I have to do it bilaterally, sorry. Let me just do that. Okay, capillary refill of about 2 seconds. No pedal edema, no sign of pitting, okay? Now I'll do it in your upper extremities. Okay, let me check for capillary refill first. Okay, if I could just have your finger. Okay, it was instantaneous. I'm gonna check for edema. No pitting. Okay, and now I'm just gonna check for Homan sign. You just tell me if you feel any pain in your calf, okay? Any pain?
No.
Okay, great. Okay, okay, so if you could just lift up the hospital gown for me.